Good morning, everyone. Welcome to episode 35 in Healthcare KX. Today, we're going to continue on parental abuse, part 2 and 3. So let's begin. Children who have experienced abuse and neglect are therefore at increased risk for a number of problematic developmental health and mental health outcomes, including learning problems such as problem with inattention, deficit executive function like ADHD, problem relating to peers such as peer rejection, bullying, blah, 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 blah. For some children, parents cannot fill their roles as a buffer and co-regulator effectively. When children have caregivers who cannot buffer them from stress or who cannot serve as co-regulator. Okay, so what I think that means, I'm not a psychologist or anything, I didn't check it out. What it means is, you don't give the child enough attention when they need it, they're never going to learn that skill. Or they will learn by themselves, but they're not going to learn from the parents who should be the primary caregiver and educational provider for the kids throughout their whole life, doesn't matter what age they are. All right? Okay, so although children can cope effectively with mild to moderate stress when supported by a caregiver, like I said, conditions that exceed their capacity to cope adaptively, oh my God, what's wrong with me today, often result in problematic short or long-term consequences. I can never say that word. Studies conducted with some non-human primate species and rodents have shown that young and dependent on the parent for help in regulating behavior and physiology. Therefore, young infants are dependent on parents fulfilling the functions of carrying, holding, feeding, educating, and all that stuff. The period of physical immaturity and dependence lasts an extended time in humans, even beyond the point at which young children are physically dependent. They remain psychologically dependent throughout childhood and adolescence. That is a type of manipulation like what my mom does to me. It's a narcissist, and I'm still learning that I'm not the only one. And, people are going through the same thing as I do, but it's harder when that person is a parent and your mother, who has been abusing you emotionally and psychologically, maybe due to jealousy, due to a reflection of a bad part of the image in her, the normal psychology stuff. So, inadequate or abusive care can have considerable consequences in terms of the children or adults' health and social, psychological, cognitive, and brain development. Lastly, children who have experienced abuse and neglect therefore are at increased risk for a number of developments, health, and mental care outcomes. These, other than inattention and deficit and executive functions, which in ADHD is different, it's actually a physical lack of executive functioning area as compared to using CBT to treat or to help with the symptoms. All right, internalizing symptoms such as depression, anxiety, externalizing symptoms such as oppositional defiant disorder, conduct disorder, aggression, and post-traumatic stress disorder. As adults, these children continue to show increased risk for psychiatric disorder, substance abuse, serious medical illnesses, and lower economic productivity. Wait for episode number 3. Thank you.